Criteria A specifies the qualitative nature of the paraphilia. So in here we have, for example, an erotic focus on children or on exposing genitals. So what this entails is that we there's a specific group of people that are being targeted, while in criteria B, that specifies the negative consequences of the paraphilia, such as distress, impairment, or harm to others. Note that criteria A and B can be mixed in some individuals, but in other individuals who have a paraphilic disorder, if an individual meets criteria A but does not meet criteria B for a particular paraphilia, we cannot consider it as a paraphilic disorder. So the etiology is unknown. Etiology is unknown, but psychoanalytical theory tells us that these conditions are all expressions of hostility in which fantasies or unusual sexual acts become a means of obtaining revenge from childhood trauma. Behavior theory entails that the paraphilia begins via a process of conditioning. So we can understand this by saying the conditioning starts from childhood, where maybe a certain behavior is being tolerated by the parents and not being scolded. So the person feels they have the rights to dress however they like, then it grows up to become a disorder in adulthood. Then the biological factors, sexual defiance is associated with frontal and or temporal lobe damage. These are subtle defects on the right amygdala. Characteristics of a person with paraphilia. Besides normal sexual behavior, paraphilic disorder involves aggression, victimization, and extreme one-sidedness. So this will be witnessed in our various paraphilias that are there, what we discussed today. The behaviors exclude or harm others and disrupt the potential for bonding between persons. Almost all paraphilias, or I can say all paraphilias usually have 6 months duration, or they are always thinking of unusual behavior. They are overly obsessed that if the individual cannot get to their desired object, they get stressed. So the individual will lose sight of other goals and concentrate on the fulfillment of their sexual desires. It causes intense personal distress or impairment in social, work, and other areas of functioning. Except for sexual masochism and sadism, all cases of paraphilia involve men. Paraphilias commonly involve sexual arousal and orgasm, usually achieved through masturbation and fantasy. So, a classification, we have anomalous activity preferences and anomalous target preferences. We will look at them later. So, the first category we have voyeuristic disorder or scopophilia. Can you kindly mute yourself, sir? Thank you. So, voyeuristic disorder is also known as scopophilia. The word comes from the term voyeur, which means to see. This disorder is a recurrent preoccupation with fantasies and acts that involve observing and suspecting persons who are naked or engaged in grooming or sexual activity. So these people are commonly called the peeping toms. This disorder is more common in men, and masturbation to orgasm usually accompanies or follows the event. So a differential diagnosis is a conduct disorder, antisocial personality disorder, and substance use disorder. DSM-5 diagnostic criteria, as we said, if an individual should have over a recurrent and intense sexual arousal from observing an unsuspecting person who is naked in the process of disrobing or engaging in sexual activity as manifested by fantasies, urges, or behaviors. B. The individual has acted on these sexual urges with non-consenting person, or the sexual urges or fantasies cause clinically significant distress or impairment in social, occupational, and other important areas of functioning. C. The individual experiencing the individual is experiencing the arousal and or acting on the urges is at least 18 years of age. Yes, so before I move on, so these individuals usually tend to repeat these they tend to repeat their behavior because mostly when they are caught, they are only charged with minor demeanor cases and then they can go back. But then these are usually secretive and they make sure that they are not caught. So a second disorder we have exhibitionist disorder. It is also known as flashing or indecent exposure. In almost 100% of cases, those with exhibitionism are men exposing themselves to women. Pardon the misspelling there. So the dynamic of men with exhibitionism is to assert their masculinity by showing their penises and watching the victim's reaction, fright, surprise, or disgust. Orgasm is brought about by masturbation during or after the event. The diagnostic criteria for exhibitionism it should be over a period of at least 6 months, recurrent and intense sexual arousal from the exposure of one's genitals to an unsuspecting person as manifested by fantasies, urges, or behavior. The individual has acted on these sexual urges with non-consenting person and sexual urges or fantasies causes clinically significant distress, impairment, social, occupational, or important areas of functioning. So we should specify whether sexually aroused by exposing genitals to prepubertal children, either to exposing genitals to physically mature individuals or to prepubertal children and to mature individuals, like they are both. Specify if in a controlled environment, this specifier is primarily applicable to individuals living in institution or other settings where opportunities to expose one's genitals are restricted. Those in full remission would say the individual has not acted on the urges with a non-consenting person and there has been no distress or impairment in social, occupational, or other areas of functioning for at least 5 years while in a controlled environment. The third one will go to fertilistic disorder. It is derived from the word frotta, meaning to rub. Fertilism is described only in men, so this disorder is usually characterized by a man's rubbing his penis against the buttocks of or other body parts of a fully clothed woman to achieve orgasm. So this event occurs in a crowded place such as the train, maybe the stadiums or the buses. So diagnostic criteria, apart from we have the, this behavior should last at least 6 months, as you have noticed with others. Then the individual has acted on these ages with a non-consenting person other than sexual ages or fantasies causing clinically significant distress. So we move on. Sexual masochism. Masochism takes the name from an Australian writer, Leopold Baron, from Leopold Baron von Sacher-Masoch. He is known for his novels about men sexually humiliated by women. These practices are more common in men and women than women. So persons with masochism may have had childhood experiences that convince them that pain is a prerequisite for sexual pleasure. About About 30% of those with sexual masochism also have sadistic fantasies. The three main characteristics of masochism are pain, loss of control, and humiliation. We should note that these people usually ask their partner to inflict pain on them for them to have the pleasure, because they believe that they can have pleasure only when they have pain and suffering. So, on the diagnostic criteria, the fantasies and sexual urges cause clinically significant distress or impairment in social, occupational, and other important areas of functioning. We should specify with asphyxiophilia the individual in the place of achieving sexual arousal related to restriction of breathing. So that's where maybe someone is being choked, then for them it's exciting. Uh, Sexual sadism. So the onset of the disorder is usually before the age of 18 years old, 18 years, and most persons with sexual sadism are male. According to psychoanalytic theory, sadism is a defense against fears of castration. Persons with sexual sadism do not do to others what they fear will happen to them, and derive from expressing aggressive instincts. Sexual sadism is related to rape, although rape is more aptly considered an expression of power. Contributory causes include hormonal malfunction, pathological relationship, and a history of sexual abuse. Let's not confuse sexual sadism with the previous masochism. Sexual sadism, this is a partner who chooses to inflict pain on the other partner, while on masochism, they want they want to suffer on their own than their partner. So, diagnostic criteria, we should specify in a controlled environment. The specifier is primarily applicable to individuals living in institutional and other settings where opportunities to engage in sadistic sexual behavior are restricted. So, again, the period should be more than 6 months. It should be recurrent and intense sexual arousal from the physical and psychological suffering of another person as manifested by fantasies, agents, and behaviors. Pedophilic disorder. So pedophilia involves recurrent intense sexual urge toward or aroused by prepubertal children. Most child molestations involve genital fondling or oral sex. Vaginal or anal penetration of children occur infrequently except in cases of incest. You should note that the people who have this disorder are called pedophiles. Although most child victims who come to public attention are girls, most offenders report that when they touch a child, 60% of the victims are boys. Then non-touching victimization of children, such as voyeuristic or exhibitionist activities, are directed towards girls. The diagnostic criteria will have the same behavior which lasts at least 6 months, current intense sexual arousing fantasies, sexual urges, or behaviors involving sexual activity with a prepubescent child or children generally aged 18 years or younger. The individual has acted on these sexual urges or sexual urge fantasies, cause much distress or interpersonal difficulty. The individual is at least age of 16 and at least 5 years older than the child or children in criteria A. Do not include an individual in late adolescence involved in an ongoing sexual relationship with a 12-year or 13-year-old. We should specify whether it's the exclusive type, where the individual is only attracted to children, and the non-exclusive type, they are attracted to both children and adults. Specify if the the offender is sexually attracted to males, females, or both. Specify if it's limited to incest. Then fetishistic disorder, the fetishes or fetishism is where a person feels a strong recurrent sexual uh, attention to a non-living object. These are intimately associated with the human body or non-genital body parts. Objects include shoes, gloves, underwear, stockings, swimsuits, etc. Sexual activity may be directed towards the fetish itself, such as masturbation with or into a shoe where they are wearing it, or the fetish may be incorporated in sexual intercourse. So, this is when they demand their partner to wear a certain way for them to be aroused instead of their partner arousing them by just being there. They should wear something which is non sexual. So, diagnostic criteria, the fantasy or the fetish objects are not limited to articles of clothing used in cross dressing, as in transvestic disorder that we discussed later, or devices specifically designed for the purpose of tactile genital stimulation. They should specify the body parts, we should specify the non living objects or other. Transvestic disorder, or formerly known transvestic fetish, is described as fantasies and sexual urges to dress in opposite gender clothing as means of arousal. Some of some as adjunct to masturbation or coitus. What this means is that we'll have maybe a man who dresses up like a woman so as to be aroused, then they will masturbate while they're wearing such clothing. Yes, so the sole purpose of them wearing these clothes is for themselves to get aroused. As years pass with transvestism, want to dress and live permanently as women. So this condition is rare in females. So on the diagnostic criteria, the fantasies should last for a period of 6 months. There should be recurrent intense sexual arousal from cross-dressing as manifested by fantasies, edges, or behavior. Should specify with fetishism if sexually aroused by fabrics, materials, or garments. With autogynephilia if sexually aroused by thoughts or images of self as female. Some rare paraphilias are the necrophilia, where a person is obsessed or likes to, or has intercourse with corpses or masturbates next to corpses. So for them, they are aroused by being near corpses or the dead people. Zoophilia is this disorder which is directed towards animals, where they have sex with animals. So the zoophilia, we can have the bestiality, where they indulge in sexual activity with the animals. And cropophilia is when sin calls for pieces. Prismaphilia is for animals. Heterophilia for urine. Autogonistophilia is having sex in front of others. Then somnophilia is having sex with sleeping people. Stigmatophilia is skin piercing or tattoo. So only people who have skin piercings or tattoo are sexually attracted to them. Then orthonepophilia is sometimes of wearing diapers. So my colleague will continue the treatment.
Good morning. My name is Tanya Kwame, and I'm taking you through my treatment. So there are five types of psychiatric interventions that are used to treat persons with paraphilic disorder and also paraphilic interest. So the examples are as follows: external control, reduction of sexual drives, treatment of comorbid conditions such as depression and anxiety, cognitive behavioral therapy, dynamic psychotherapy. Surgical treatment, we have neurosurgery and castration. Pharmacological psychological treatment and the androgens. These aim to reduce libido, erections, ejaculations, and spermatogenesis. The common drugs that are used are cyproterol acetate and methoxyprogesterone. Hormonal agents. These are agents that inhibit secretion of luteinizing hormone with a resulting decrease in plasma tes- testosterone levels and libido. Drugs that are used are liprolite and trip, tryptophan. These are long-acting gonadotropin reacting hormones. Yes. Then we have selective serotonin reuptake inhibitors such as sertraline, fluvoxamine, and fluoxetine, who are equally effective in reducing paraphilic symptoms. So, psychological and behavioral treatment. Cognitive behavioral therapy is used to disrupt end paraphilic patterns and modify behavior to make it socially acceptable. Insight-oriented psychotherapy is a long-standing treatment approach. Interventions that are used, we have social skills, sex education, cognitive restructuring, relaxation technique, and learning what triggers the paraphilic impulse so that such stimuli can be avoided are also taught. The prognosis. So the prognosis is better if the problem is secondary as compared to primary. If the symptoms are less than a year, both partners are calm and the relationship is stable. As a result, both partners find pleasure in their sex life. The differential diagnosis, we have non-sexual mental disorder, substance or medical use, inadequate or absent sexual stimuli, interpersonal factors, as well as other sexual dysfunction. Our references, we have Kaplan and Sadok's synopsis of psychiatry, 12th edition.